Hello guys. This is Dr. Rizwan Mirza. Welcome to my channel Advertologist.
Hello guys. Let's discuss about an issue which is common but is seldom discussed openly due to embarrassment, that is hemorrhoids, commonly known as piles. Hemorrhoids, also known as piles, are swollen and inflamed veins in the rectum and anus that result in discomfort and bleeding. There are two types of hemorrhoids. They can be internal, located inside the rectum, or external, found under the skin around the outside of the anal opening. Hemorrhoids is commonly caused by constipation, or straining during bowel movements, obesity, and pregnancy. Symptoms of hemorrhoids may include 1. Rectal bleeding, especially during bowel movements. 2. Itching or irritation in the anal region. 3. Pain or discomfort. 4. Swelling around the anus. 5. A lump near the anus, which may be painful. Hemorrhoids can be classified into 4 stages based on their severity. First-degree hemorrhoids presents with bleeding but they do not prolapse, or extend out of the anal opening. They typically cause itching or discomfort rather than pain. In second degree, hemorrhoids prolapse, but they retract spontaneously, that is they return to their normal position, during bowel movements. They may cause bleeding and discomfort. In third degree, hemorrhoids prolapse and must be pushed back inside the anus, as they do not retract spontaneously. They may cause bleeding, pain, and discomfort. Prolapsed hemorrhoids are more noticeable and may require intervention for relief. In fourth degree of hemorrhoids, they prolapse and cannot be pushed back inside the anus. Often associated with significant symptoms, including bleeding, pain, and discomfort. Can lead to complications, such as blood clots or strangulation of prolapsed hemorrhoids, which is the loss of blood supply to the hemorrhoid. The diagnosis of hemorrhoids typically involves a combination of a medical history and physical examination. In the medical history, symptoms, including any pain, bleeding, or discomfort are asked, and patients are inquired about their bowel habits, diet, and lifestyle. To assess potential contributing factors. In physical examination, a visual examination of the anal and rectal area will be performed. The doctor may perform a digital rectal examination to check for abnormalities, in which they will use lubricant before examining the area. The doctor may perform proctoscopy, in which a proctoscope is used to examine the anal and rectal area for any abnormalities. Treatment options may vary depending on the stage of hemorrhoids. Early stages may be managed with lifestyle changes, dietary adjustments, and over-the-counter medications. As hemorrhoids progress to more advanced stages, medical procedures or surgical interventions may be recommended by a healthcare professional to alleviate symptoms and address the underlying issue. Some lifestyle changes that might help in hemorrhoids include increasing fiber intake, drinking plenty of water, and regular exercise can help prevent constipation and reduce strain during bowel movements. Over-the-counter creams, ointments, or suppositories containing ingredients like lidocaine, hydrocortisone or diltiazem can help alleviate symptoms. Warm baths. Soaking in a warm bath for 10 to 15 minutes several times a day can provide relief from symptoms. As the stage advances or patient symptoms get severe, a surgical procedure is advised, which include 1. Hemorrhoidectomy. This is the most common and effective surgical procedure for severe hemorrhoids. It involves the removal of excessive tissue causing the bleeding or protrusion. Can be performed using various techniques, including traditional excisional hemorrhoidectomy or newer methods like stapled hemorrhoidopexy. 2. Stapled hemorrhoidopexy. This procedure is also known as stapling or stapled hemorrhoidectomy. It involves using a circular stapling device to remove excess tissue and lift the hemorrhoids back into their normal position, generally associated with less pain and a quicker recovery compared to traditional hemorrhoidectomy. 3. Hemorrhoidal artery ligation. This procedure focuses on reducing blood flow to the hemorrhoidal tissue. It involves using a Doppler ultrasound probe to locate the arteries supplying blood to the hemorrhoids. The surgeon then ties off these arteries, reducing blood flow and causing the hemorrhoids to shrink. 4. Rubber band ligation. Commonly used for internal hemorrhoids that protrude during bowel movements. It involves placing a rubber band around the base of the hemorrhoid, cutting off its blood supply. The hemorrhoid eventually shrinks and falls off within a week. 5. Infrared coagulation. Infrared light is used to coagulate the blood vessels feeding the hemorrhoids. The procedure is typically performed on internal hemorrhoids and is less invasive than some other surgical options. Some potential complications of hemorrhoids include 1. Strangulation, in which prolapsed hemorrhoids may become trapped outside the anal opening and lose their blood supply. This is known as strangulation and can lead to severe pain and tissue damage. 2. External hemorrhoids can develop blood clots, causing significant pain, swelling, and inflammation. This condition is known as thrombosed hemorrhoids. 3. Anemia. Chronic bleeding from hemorrhoids, even if it is low-grade and intermittent, can lead to anemia over time. Anemia is characterized by a reduction in red blood cell count and can cause associated symptoms like fatigue and weakness. 4. Infection. Scratching the irritated area around the anus or using harsh toilet paper can lead to breaks in the skin, making it susceptible to bacterial infection. 5. Anal fistula or abscess is formed in some cases due to persistent inflammation and infection around the anal area. If you suspect you have hemorrhoids or are experiencing symptoms, it's crucial to consult with a healthcare professional for an accurate diagnosis and appropriate treatment plan. If you have any questions or queries, please leave us a comment.
Subscribe to my channel at YouTube at Gharelu and press the bell icon for updated video. You can also follow my page at Facebook and follow me on Instagram. And if you like the video, don't forget to like and share the video.